Professor Liang Wang and honored foreign professors and our audience. I will to share some data about the diagnosis and treatment of heart failure in China last year. As you can see, the data source is HQMS. We enrolled heart failure patients over 18 years during hospitalization with the main diagnosis or other diagnosis of heart failure. Discharge data is from January 2022 and to December 2024. The data shows 74% of patients is with the age over 65 years of heart failure. The data show average age of 71 years and the median age of 72 years. About 45% patients are female without significant changes. Numbers increase with age, with the highest proportion between 65 and 74 years. How did the patient's admission? The sources like this: in 2024, 70% admitted from outpatient, while 27% from emergency department. No significant changes compared with the 2022 to 2024. In 2024, main diagnosis of heart failure account for 82%, other diagnosed with 18%. No significant changes diagnosis type from 2022 and 2024. In 2024, only 66.3% of hospitalization patients with heart failure with diagnosis of NYHA functional class diagnosis standardized for heart failure need to be improved, just fake shows. We also use NYHA and CALIP classes proportion for patients hospitalized with heart failure. CALIP classes only for the ischemia heart disease, especially for myocardial infarction patients. HQMS data shown in 2023, 55% patients with NYHA functional class 3 to 4, 42% with CALIP 3 to 4. In 2024, 53 patients with NYHA functional classes 3 or 4, 42 with CALIP 3 to 4. No any difference, significant differences between among 3 years. What is the comorbidities among these patients? As you can see, CAD, coronary artery disease, and hypertension are the most common cardiovascular comorbidities of heart failure. Like this is coronary artery disease, this is hypertension, and atrial fibrillation and flight cardiomyopathy only 3.6. Cardiogenic shock is among them is about 1.2. Cardiac arrest is about 0.7. Diagnosis about 70% with heart failure diagnosed with coronary artery disease and around 60% with hypertension. Another comorbidities, just like a stroke, COPD, and diabetes mellitus are the most common among the non-CV heart failure patients. you can see the stroke is 34, 33, 34 among 3 years. COPD like this, diabetes mellitus, pulmonary infection, and hepatic disease, coronary kidneys. We use this disease to classification. Number of the hospital patients from national platform for single disease quality management and control have been increased year by year, because in China the government wants us to do some things for the single disease quality management. Data source is national platform for single disease quality management and control. Patients also with heart failure include inclusion criteria as following. So many hospitals join this work. In 2024, among patients hospitalization with heart failure, only 42% with natriuretic peptide test with 24 hours after admission. The only 41% with echocardiography test within 48 hours after admission. Thus, the clinical valuation rate for patients with heart failure needed to be improved, especially in the rural areas. But I think maybe the echocardiographic test is easy than a lot of countries. In 2024, among patients hospitalized with heart failure, the evaluation rate of chest X-ray, electrocardiography, and cardiac troponin I and troponin T. After admission, the test rate, like the slide shows, 20, 22, 62, 26, 10, 11% respectively, which needs to be, we also want to be improved in the future. How do we use the GDMT for patients with heart failure at discharge? In 2004, usage rate of discharge of ARNI, ACE-ARB, beta block, MRA, and SGLT2 inhibitor in patients with high BRAF, like the data shows. All of which were higher than those in HFmERV and HFpAF. Recent years in China, from 2022, the Advair have launched in China. We use Advair is increased sharply, just like the figure shows. This year to the August, about 731 patients implanted the Advair. Advair, most Advair is domestic types. Only HeartMate 3 also go into Chinese hospitals, but the proportion is lower because last year HeartMate 3 enrolled into the China. The heart transplantation is also a main treatment for the end stage of heart failure patients in China. This is the heart transplantation patients. Last year is 1,064 cases. Rate of in-hospital mortality and non-prescribed discharge for heart failure patients decreased. SHQ-MS data showed the nationwide in-hospital mortality rate and the non-prescribed discharge rate for heart failure patients were 2.2 12%, and 7.06% in 2004, respectively, both of which were lower compared to 2022 and all 2023. The in-hospital mortality and non-prescribed discharge rate in tertiary hospitals was slightly higher than those in secondary class hospitals, which might be related to more complex conditions of patients in tertiary hospital. The severe patients go into the tertiary hospital. The second class hospital, most are the mild patients. About 10 to 11% of patients with heart failure readmitted within 30 days after discharge. Just like this figure shows, China, compared with other countries such as Korea, US, Australia, Canada, and Israel, Greece, and so on, is in the middle, about 11%. Compared between China and the US, we can see the median age is same. Proportion of female is similar. Coronary artery disease in the United States is much higher than in China. Hypertension, China is much higher. Or US is much higher. The blue column is China. The yellow orange column is United States. We compare with the AFL, diabetes mellitus, coronary kidney disease, and stroke. All Chinese research study show like this. Compare with between the Chinese and US, how do we use the 4 pillars therapy? As you can see, the beta block, the ANI is similar as between two countries, but MRA is much more in China, because Chinese doctors think MRA not only receptor agonist, also diuretics. The SGLT2 inhibitor use is much more than the United States. Conclusion: the patients hospitalized with heart failure in China have complex conditions and multiple comorbidities, just like kidney dysfunction, just like other comorbidities. The standardization of diagnosis and treatment for patients with heart failure in China needs to be enhanced, as we discussed compare with the United States. The prognosis of patients with heart failure in China needs to be improved, because till now, although the death rate in hospital is decreased from 2022 compared with the 2024, but still a little bit higher than other countries. So this data shows the real situation in heart failure in China. Thank you very much.